have crooked teeth, the thought of metal traditional braces aren't your only option. Welcome dentist Dr. Terri Alani back to the show and her patient Georgia McKissick. Hi there.
Hello.
Okay. Dr. Alani, the cool thing about your office is that you can handle a wide range of things. It used to be that if you had the really crooked teeth, that the only thing you do is just go to the orthodontist, but you can actually initially come into your office so you can assess what the situation is.
Exactly, and I have now started doing Invisalign, but I'm doing simple cases. I work very closely with the orthodontist and Dr. Nasser, who's in the audience. We work really well together. Invisalign is basically for patients that have crowding, spaces between their teeth, or like Georgia, who had orthodontics when they were younger, and then the teeth relapsed, maybe because she didn't wear a retainer, or possibly just the teeth have shifted over time.
Georgia, had you gone through the traditional braces when you were a kid?
Yes.
Yeah, and so what was that like?
Terrible.
The metal? Yeah, the metal, especially at like, what, 12 years old?
Very painful.
Yeah,
yes.
yeah. Okay, so over time, as you mentioned, I know my wisdom teeth came in like in my 20s and just crowded up all my teeth, so it changed things. When did you first start noticing that shift, and how did that bother you?
Probably, I'd say about 10 years ago. It seems like the space was getting bigger, and then the crowding in the bottom teeth was starting back to the way it was when I was young.
But I bet the thought of putting metal braces back in.
I was not going to do that again.
I actually wore the traditional braces.
Yeah, you did, but your teeth are beautiful.
And I did not eat spinach for weeks, trust me. So stuff gets all in. And these are awesome because they're comfortable and they're invisible.
Yeah. In fact, let's get a close-up. If you were small, Forrest big, we're going to get a close-up of your mouth. And thanks to modern technology, it's really interesting because there's her mouth. She's got this Invisalign in right now. And here is the actual, if we can get a close-up of this, here is the actual little tray or liner or whatever you want to call this, right? And it's amazing because you think this wouldn't move teeth.
And it does. And basically, it's a series of clear aligners. They're removable, so you replace them, you remove them when you brush or floss or you're eating, and you wear them about 22 to 23 hours out of the day. Compliance is really important, so we do them for teenagers and adults, but discipline is absolutely imperative to keep them in. The aligners are replaced about every 2 weeks, and in the simpler cases, the patients will probably wear a series of 12 to 15 aligners, so you're talking 24 to 30 weeks.
Okay.
Now, Dr. Nasser will do the more complicated cases, and those aligners, you're usually in there for a little bit longer time.
So at what point we say more complicated cases, are those cases that don't qualify for Invisalign, or just maybe a little surgical work might be combined with that?
No, it's more complicated. There might be a little bit of a bite problem, a bite issue, where you need to wear elastics. There's not much that you can't do with these, with the Invisalign treatment, at least in some capacity. Sometimes the more difficult cases, really significantly difficult ones where there's lots of crowding, maybe where you actually have to have some extractions done to get enough room to align the teeth properly. You might have to have a combination where you do even some of the traditional braces at first and then go into the aligner. So there's always, we have our ways.
Yeah, we have our ways.
Sometimes actually, for patients, you know, people ask us, well, when do I do veneers versus Invisalign? And that's a really good question because Invisalign does not change the shape of your teeth nor the color. So for patients that might even actually go into Invisalign, get their teeth in a straight position, but they don't like the shape or the color, because if you have short, worn teeth, Invisalign will not correct that.
It may straighten out some stuff, but you're still going to have that. And I've done actually both. And on the I had veneers on the top, and then in wearing these, it was amazing to me of how they can move your teeth. You've been wearing them for how long now?
5 weeks.
And you've already seen a little shift.
And they're not really.
But it's not painful.
Yeah, they're not painful. That's the interesting part, because when I wore my traditional braces, I promise you, they were awesome, but I felt like I had eaten barbed wire.
And they go in and start tightening them, which this kind of is a gradual tightening that shifts your teeth.
It's very slow, very gradual, very.
All right.
I mean, it's wonderful.
So something for people to definitely look into. And Dr. Alani, let me just say about you are so cool to work with, because you seek to get the best for the patient, and that even means, you know, handing business at times over on to another dentist if they can do take it beyond what you're doing.
And it's really important to work with your other professionals and your specialists. And Dr. Nasser and I mean, he helps me a lot with my cases. We do a lot of consulting back and forth, and I think that is one of the main importances of a general dentist, is to be able to be the gatekeeper to provide the best quality for your patient.
All right. Thank you very much. Thank you for coming in. Here's to straight teeth. And thank you, Dr. Nasser. For more information on services Dr. Alani offers, you can call 713-621-5141, 713-621-5141, or log on to texastoothlady.com.